Williams. We're doing a talk today on cannabis, the essentials of CBD. And so a little bit more about myself. I am a family physician by trade. I worked for the Cleveland Clinic for nearly 20 years. And I opened my own medical cannabis and coaching office a little over a year ago now. Our main office is in Columbus. And we have our satellite office up here in Cleveland. This really started when I became pretty frustrated early on, so that for every patient there was a pill, and for every time you come in there's another pill. If you don't like that pill, there's a pill for your pill. And over time I was frustrated, and my patients were frustrated as well. So for the patients I was seeing, the diabetes, hypertension, high cholesterol, many of them wanted to do something different. And so we actually started working on increasing their self-esteem, working on building confidence, and then redefining wellness beyond the numbers. So beyond the diabetes, beyond the blood pressure number, beyond the cholesterol number, really defining what does wellness mean to you. And when that started to happen, we started decreasing their medications, working on the diet and exercise, and really taking people off of their meds. With time, some of those patients actually became more interested in incorporating cannabis, and I started looking into it and was very surprised by the amount of research, the amount of possibilities that were there. And so with that, fast forwarding many years, when cannabis actually came to Ohio, I decided to become certified. A little disappointed when I looked at the offices that were available were not as focused on education as I would have preferred. And so I became certified, not just with cannabis, but actually in medical cannabinoid practice, as far as education and coaching, and then eventually also life coaching as well. And so besides owning my own practice, I also teach at the Cleveland School of Cannabis. So this is our office there in Columbus, and these are our locations, as well as we do pop-up clinics in other areas, as well as home visits for our most ill patients as well. So today we're going to really look at some of the history of cannabis a little bit, and what is it? What is the endocannabinoid system? What exactly is CBD? And how do we choose the CBD that we take, and is it actually good for you? Is the right product for you? So a lot of people are not aware that cannabis really started, hemp was a cash crop in the U.S. That when the colonies were forming, the Queen of England actually mandated that farmers grew so many acres of hemp and send that money and send those crops back to England. And it was a part of our U.S. pharmacopoeia, so the listing of all the medications that are available in the U.S. So hemp and cannabis was a part of the U.S. pharmacopoeia from 1950 to 1937. And so it was really a part of our culture. It was never really an issue. So what really changed is that after the alcohol prohibition failed, basically, where cannabis had been addressed previously and had been decided that it wasn't an issue whatsoever, when prohibition failed and big pharmacopoeia came in and required that that they were going to start creating synthetic medications, cannabis was a big competition for them. And so when that started, then the ban on cannabis started to form. And so really around the time of the Mexican Revolution, there was an influx of Mexican Americans, basically immigrants that became U.S. citizens at that time, and then bringing also cannabis with them, and then the backlash started. And so by the 1937, the Marijuana Tax Act was put into action. And so at that point, they were taxing the pharmacists, the doctors, the farmers, anyone that was involved in hemp and cannabis, and created more of a difficulty for people to use it. And so eventually, with years of guidelines and criminalization more and more over the years, and more confusion about what did cannabis really do. By the 1970s, we started to then again create more issues with cannabis, and Richard Nixon then signed the Controlled Substance Act, which then brought, that then said that cannabis had no medicinal value, as well as had that was highly addictive, which none of those were true, but at that time it was supposed to be temporary, but to this day it's still considered a Schedule I medication. Within a medical marijuana state, it's considered Schedule II, but federally it's still considered Schedule I and considered a highly addictive and medication with no medicinal value. And so during that, but a lot of the fear really developed during that 1930s. After Prohibition died for alcohol, the Reefer Madness movie was developed, which was supposed to scare people from using it. And to be honest, those same fears are what we still battle today. So what is cannabis actually? So basically we're talking about really 4 plants. So there's Cannabis sativa L, which is the hemp plant by itself. It's high in CBD, but very low in THC. And then the other cannabis plants, which we often term as marijuana, but the other cannabis plants, sativa, indica, and radialis, are more of a THC variety with lower CBD portion. And so the radialis, which you rarely hear about, is usually very small, very low in THC, kind of low in C. So there's not a whole lot of use to it, except for it can be used in cooking many times as well. But what we really focus on is the THC and CBD in these plants, right? But there are 100 cannabinoids that are part of cannabis, but we tend to focus on THC because of the psychoactive part, and CBD really now, more recently, because of the medicinal aspects that we've discovered. So you can see here the sativa plant's kind of tall, has a longer stalk that can actually be used to create fibers and build blocks or almost bricks that people can use in building homes. Really, clothing is a big part of the hemp industry as well, where you can see indica is a little bit more of a Christmas tree look with a wider leaf, and then poor radialis, which is, I mean, maybe that's where the word weed really comes from, because not a whole lot going on there. Poor thing, right? Didn't want to leave it out though, right? So what is the endocannabinoid system itself? So as you can see here, there's the systems that make up our body are around the circle. And the endocannabinoid system is as important than your respiratory or cardiovascular, because it basically works with all the other systems to keep your body in balance. And so without it, you suffer from illness. And as you can imagine, that if your heart isn't working correctly, if your lungs aren't working correctly, how badly that can affect you. When your endocannabinoid system is not functioning, that can also have a big effect on your health as well. So the endocannabinoid system was really discovered in the early to mid 90s, which is part of the reason that most of your physicians are not as aware of it, because it was really discovered during that time, and then it's been gradual building of research during that time to actually create enough information to make it part of the medical information. However, it's still very slow. Of all the medical schools across the country, I think maybe about 13 actually even talk about it. But the real focus here, as I said before, is balancing your body. And so the endocannabinoid system is a set of receptors and neurotransmitters, which are those cannabinoids that interact with your body. So you have the CB1 receptors that focus on your brain and your central nervous system. THC tends to act with that more, and so that's where that euphoric feeling comes from. Where the CB2 receptors are riddled throughout your body, in your skin, nearly in every organ, and CBD interacting with those receptors along with the other cannabinoids is what creates the balance. But these are really just the supporters, because your body has its own cannabinoids. And so the endocannabinoids are the anandamide, the 2-AG, and so THC mimics our endocannabinoids, so it kind of boosts what our body's already doing, where CBD actually allows our natural cannabinoids to stay in the synapse longer in those neurons to make it work better. So CBD really takes what your body's doing and just makes it work a little bit better. So, I don't know if you remember, this is like from the 80s probably. So it was a V8 commercial.
Oh, yeah.
Okay, and so, so basically, I often kind of refer back to this because basically the endocannabinoid system is what helps this guy get standing up straight again. And so you think that you're functioning well, right? But the nuances of the endocannabinoid system might not be apparent to you until you actually make those corrections, and then all of a sudden you're sleeping better, you're feeling better. It's because either the receptors weren't working as well as they should, whether you needed a boost in those natural endocannabinoids, and it makes a difference in how your body works. So a little bit more about CBD. It's big, right? Like you can go to Family Video, which I don't even know what they sell. If it, like, doesn't people have Netflix? So I'm not quite sure what Family Video, but that's why they have CBD, because they don't have video? I don't know. I don't know what's in there. Hopefully Family Video isn't following up on this, but so CBD is cannabidiol, which is the non-psychoactive part of cannabis. And as I mentioned before, it increases the production of your anandamide, of your 2-AG, and so it limits the absorption of it. So it keeps your natural endocannabinoids working longer and stops that breakdown. And so CBD helps with nausea, vomiting, pain disorders, seizures, psychosis disorders, inflammatory disorders. It helps with decreasing tumor growth. It decreases the blood supply to tumors as well, and helps with anxiety, depression, and neurodegenerative disorders like Alzheimer's. So this is just another way of looking at it, that the main things that people end up coming in for is that they want to really sleep better overall. I'll tell you that's a big reason that people come into the office. But they want to decrease their anxiety, right? They want to have less stress. They really want to decrease their pain. And then we start looking at the seizure disorders, which a lot of CBD, what people know about CBD really developed because of Charlotte's Web and what they were doing out in Colorado for Charlotte, who was a little girl that had a seizure disorder, fighting cancer and neurological disorders as well. So since cannabidiol does not cause psychoactive effects, it's an excellent option for people seeking the benefits of cannabis products without the high. And so one of the most common questions or concerns I get when people are coming into the office is, I don't want to get high. And this fear of the unknown, which is really what it comes down to, right? So CBD has the ability to block the negative effects of THC. So for some people, that euphoric feeling is an added benefit, and for some people it's considered a negative side effect. And if it feels like a negative side effect for you, CBD will block THC from actually binding to the receptor. So it allows you to get some of the benefits, because you'll still get some THC binding, but it decreases the ability to get that euphoric feeling. Another option is black peppercorns are basically a phytocannabinoid that acts a lot like CBD and can do pretty much the same thing. So another thing that people often talk to me about is that CBD, they don't feel anything, it's not working for them, and it's not about what you feel, the focus is on what you no longer feel. So it's the absence of sleeplessness, it's the absence of discomfort, the absence of that anxiousness and that anxious feeling, the absence of stress, and the absence of that brain fogginess that people feel. So if you change your perspective for what you think CBD is doing for you to really focusing on what are you no longer dealing with, then you really see what CBD can do. But it's hard to talk about CBD without adding a little THC in there. And THC helps your body simply work better. It kind of boosts up that anandamide that's already in your body. And so it is similar, like I said, to your endogenous cannabinoids. People will also use it raw, and so it doesn't give a psychoactive effect at all, but you can still get medicinal benefits from it. And it's really helping with being a great bronchodilator. It's one of the most common reasons that that the medical program even started was for glaucoma itself, that there was evidence that it helped decrease the eye pressure that people with glaucoma were dealing with. It has anti-inflammatory effects, anti-spasmodic, the nausea and vomiting. It helps stimulate your appetite. It decreases neurotoxins in the brain and helps stroke and brain cells, helps stroke victims and helps build up brain cells. And it's a great pain reliever without the stress on your kidneys, liver, and creating GI ulcers, which is after having so many years where we used to use so many anti-inflammatories, and then we switched to all of the opioids, and that didn't go well, right? So now there's this kind of pulling back, looking at anti-inflammatories again, but we're so much more knowledgeable about what it does to your kidneys and what it does to your liver and GI system. And so this is an excellent option for people that deal with a lot of pain. Anxiety, depression, helps with alcoholism. People that are dealing with opioid addiction, this can help kind of smooth out those rough patches for them, and is definitely helpful for PTSD as well. People will notice they feel more creative and that it helps with their mood, and can also help with your sleep, and is excellent for the bone metabolism to hold off arthritis and osteoporosis. So as I was mentioning about the black pepper, so black peppercorns, if you chew them, it can release the phytocannabinoid that's much like CBD and can decrease that high feeling. But there's other times that you're interacting with cannabinoids that can be beneficial for you. So for the people that say they want nothing to do with cannabis or anything that might be related, if you're ill and you're using echinacea, echinacea is working directly with those CB2 receptors, and most of those receptors are within your immune system. Black truffles have anandamide in it, which is similar to what we have in our body. And if you like chocolate, it's probably because of the anandamide, and it gives you that kind of euphoric feeling a little bit, right? So obviously the darker the chocolate, the more of that you get. So it's already a part of who we are and what we're using. And so we're talking about anandamide, and anandamide is actually, or ananda in Sanskrit means bliss. So I don't know if you remember Hershey's Bliss chocolates. I don't know why they don't make them anymore, I don't think. But I don't think that was just a coincidence. Ananda means bliss in Sanskrit, and is, people like their chocolate, right? So there are so many CBD products. How do you choose? I'm not going to pick on any particular company at this point, but you can go everywhere, right? And you can find CBD. And so how do you know what you're getting? So you don't need a medical cannabis card to obtain CBD. The 2018 Farm Bill made industrial hemp and hemp-derived CBD legal to produce in all 50 states. You can also carry it on airplanes now. You can carry it to Disney World now. So basically, anywhere you go, you're seeing a sign for CBD somewhere. But how do you actually choose your products? And so you want to select reputable companies. It's not FDA, there's no FDA oversight. And so when you're looking at what you're choosing, you have to kind of look in other areas, being that the FDA is not having any claims on any of the CBD products that are out there. So the first thing I would say is that if the company that you're reading about or someone's introducing it to you, if they're saying that it is curing anything, then you should run, because they're definitely leading you down the wrong track. Keep in mind that many of our pharmaceutical medications don't necessarily cure either. They help things. And so for them to say it's curing anything is not a good idea. Check to see if you're buying things that are actually grown in the U.S. So if many times a lot of these products can be a lot cheaper if they're grown overseas and shipped over here, but then the age of that plant, the processing of it, it can actually deteriorate, the quality of it fails. So you want plants, the fresher they are, the more that they're processed in a clean facility, the better. And then check for lab testing. Assure that there are no preservatives, there are no metals, there's no chemicals in it, and that's really the big difference. That it's easy to create a CBD at a lower price if they aren't testing for any of these chemicals. And so if the price is really low, so is the quality. So the products that we have here today, doctor recommended, and they're safe, reliable, and we do actually test more than once with each batch that we bring in. And so how do people consume CBD? I actually had a guy come to a talk last night who is actually using CBD cigarettes that you can't buy here, okay? But unaware that you cannot smoke or combust in Ohio, so it was kind of good that we had this conversation. But people smoke it just like they might smoke cannabis, okay? But the preferred method is actually vaporization. And the difference is whenever you combust, you're burning. And when you're burning, you're releasing carcinogens. Where with vaporization, you're actually just lifting up the cannabis or CBD to a boiling point. And just like you might have your albuterol or your nebulizer treatment, you're just getting the vapor from it. It's a little bit, what you appear to think is smoke is a little bit denser than you would have with a nebulizer, but the nebulizer is also in water, and so that it looks lighter. What you're getting is still a vaporized mist as opposed to smoke that's burnt. So here are a couple examples of vaporizers. The three of them obviously are handheld ones, pens. You can use a dried flower in the one all the way to the left. And then you also see the Volcano, which is actually a tabletop vaporizer that you have a large plastic bag that's connected to it. And so you end up putting the dried flower on top. And then as it starts to heat up and boil, the mist actually fills the bag. It's kind of making a comeback, but initially volcanoes were very popular because in research, it was one way to measure exactly what everyone was getting. So if someone is smoking and you're using them inhaling, two people might inhale totally different. You know, one person's barely able to suck anything down, the other person has like lungs from who knows what, right? And so volcanoes were a way to actually measure exactly what people could get. So here is just dried flower bud there. This is actually after being ground up and actually put into a cigarette or paper, which is not recommended in Ohio. Did I say that? Okay. But people will also obviously make it and process it into oils, into topicals. We'll use it into pills or gels as well, gel caps, as well as edibles, like gummies, or making it more into a butter that they can actually include into other cooking methods, which is also not approved in Ohio. So. Yeah. But what you'll see when you're looking at CBD products, that there's different ones, right? And so there's ones that are considered full spectrum, broad spectrum, and then a CBD isolate. So a full spectrum is going to be CBD along with other cannabinoids that are helpful as far medicinally, and THC, but it has to be less than 0.3%. So that 0.3% is what is mandated in Ohio. Other states have little minor variations of that, okay? Broad spectrum will have CBD with the other cannabinoids that are helpful, whereas CBD isolate is just going to be CBD by itself. So how do you dose? So people are asking this all the time. Partly, there's no set dosing schedules. People use anywhere between 2.5 milligrams to 1,500 milligrams a day. And that varies so much on what you're trying to treat for your condition. So you'll see the chart here that really highlights CBD as the orange dot, and if you're looking at some of the different conditions here, it has the other major cannabinoids that you might find in a full spectrum or in a broad spectrum, and then it has the THC levels that you might find more in a full spectrum, right? And so for pain, you'll see CBD is, for the analgesic, the top one, you'll see CBD is one of the major aspects of treatment, along with some of the other cannabinoids, and then the last stop there is THC. Where if you go all the way down to neurological, for anti-anxiety, a great deal, you can start treating your anxiety just with CBD by itself. So we often use this to help figure out what products someone should use, as well as helping them see themselves compared to cannabis products. Many times I recommend whatever you choose as the product that you're using. If you're buying an oil or a tincture, start with 1/4 or 1/2 of a dropper. You want to use the least amount that is effective for you, and then do that for a couple of days. Try to get a sense of what's working. If your endocannabinoid system is a little dull or not very active, it might take anywhere between 3, sometimes 10 days possibly, for you to notice any difference at all. And then increase the dosage every couple of days until you find something that kind of works for you. But CBD has the ability to replace other medications. So we have found great success with decreasing pain medications for our patients, sleep medications, as well as anxiety medications as well. CBD alone can help, but sometimes THC is needed to give that extra boost, or I say the frosting on the cake. But the concept that CBD is fantastic and good and wholesome and THC is bad is the wrong way to look at this. That CBD and the other cannabinoids do a great deal of the work, but THC is that added effect that can make a big difference in how well it works for you. So is it right for you? So everyone's a little bit different, right? So some people get CBD and they're like, it doesn't work at all. For other people, within 10 minutes, they notice a huge difference. A lot of that can have to do with your metabolism. Not just how quickly you burn things, but the actual enzymes that might be in your liver that help break down things. And sometimes you might have enzymes that make things break down very quickly, where other people it doesn't really break down at all. You just have a harder time metabolizing it. Also your method of administration. If you're using an oil, and depending on what oil that CBD is in, you might actually have to hold it there for a minute. Many times you'll see things, hold it for 15 seconds, hold it for 30 seconds. It's pretty hard to absorb anything within 15 seconds, right? You might get a little bit, but the longer you hold it there, the better. In an oil that is a smaller molecule oil, you can really absorb something pretty well within a minute. If it's a larger molecule oil, a hemp oil, you really need about 3 minutes or more for it to really make a difference. And then the set and setting. What is your mindset going into this so that you can see how CBD is going to work? And if you're already kind of set up that this isn't going to do anything for you, it's hard to actually acknowledge the difference that it's making. And if you're not trusting the environment that you're in, or where you got your CBD, or if you even think the CBD is quality, how you interpret the difference, you might not be able to see much of a difference. But at this point, 40% of Americans use some form of alternative medicine. So there is this great desire to do things differently, and CBD has been a part of that new desire. 1 in 5 American seniors are using CBD, and I have found that at one of my talks at a senior center, one of my questions is how many people have bought CBD off of Amazon, and all the hands are going up, and Amazon does not sell any CBD. And so, so we really do want to be careful with this information, that you're knowledgeable enough to choose your product and know that if it says hemp seed oil, there is no CBD in the seed of the hemp plant. CBD may offer new hope in managing many conditions for some people. I've had patients that have high allergies to a lot of medications, and CBD is the one thing that makes a difference for them. that they have failed multiple treatments, or have really just run the gamut and really are at a point where the side effects of the medications they're taking are too much to even consider the benefits, basically. Cannabis and CBD can be a lot safer, and consider that 19,000 deaths a year occur from prescription opioids. So at the very least, it's worth at least being acknowledged. Another aspect of this is that cannabis and CBD can actually be more cost effective. So the prices can be high whether you're going to the dispensary or buying CBD products. But if you consider particularly for a lot of seniors, they can spend $3,000 on prescription meds a year, depending on what they're trying to treat. Where when they started using cannabis and CBD products, it was more like $650, depending on the state that they were living in. So honestly, less medication leads to less side effects. And when the question comes up about how much do we really know about it, there have been over 10,000 studies to determine, human studies mind you, there have been much more than that, but there have been over 10,000 human studies to determine the efficacy of cannabis and CBD. So this isn't just going on completely without anyone paying attention. So really my medical recommendation is to really keep an open mind and be knowledgeable when you're buying and looking at different products. There are opportunities to make adjustments in your own medication regimen, and if you can use CBD and use it on a regular basis, you can actually make a difference in your health. And that's it. Any questions?
I have a couple.
Go ahead.
I'll start with the easiest one. My daughter is a junior in college, perfectionist, anxiety, just like her mother. What would be good for a 21-year-old that just needs to take it down a notch so she can not be so high strung?
Absolutely. So she could definitely start with CBD, right? A full spectrum gives you a lot more options because you have more cannabinoids in there. But for some, and particularly sometimes younger people, it can make them feel a little bit more sleepy. So she could even start with a CBD isolate, see how that goes for her, adjusting the dose over several weeks. If it's not quite enough, then maybe moving up to a full spectrum. But she should find some benefit just from the CBD itself. The real difference is that if you're not using it daily, then you don't really get the benefit. It has to build up a little bit.
The next statement I wanted to make is I have a 97-year-old father, and I was able to, last year I did get him his card, and he is off prescription narcotics. And I actually brought what I get from the dispensary. My question is, I've been kind of on my own as far as dosing and what to get. So I get a product that I believe is THC and CBD, and we give them 2 drops 5 times a day.
So this is an oil, a tincture of some sort.
Tincture. But then at night we give them more CBD because we're trying to help them sleep.
A different product, or
a different product? Like I said, I'm not. I'm getting in the CBD from mustard seed, the Lux brand, and then the other drops are
from the dispensary. Okay.
I always feel like I can be doing better for him. He has dementia and he has severe spinal stenosis. It has helped, and he's not on prescriptions anymore, so I'm grateful for that. But he seems too sleepy throughout the day, and then I don't know how he's sleeping at night. So that's. I always, and my sister's like, you're doing great, but I always feel like I can be doing better for him.
And so the real problem, well, he's probably sleeping okay, but you're not quite sure. But the real problem is that he's actually sleepy during the day.
He's sleepy during the day most of the time. When we first started it, it was like, it has been a miracle. And I'm, like weaning him off the meds and stuff was great, but he's able, he is for the most part able to interact better, and he says our names were a year ago he couldn't know, he didn't know our names, so it's a true blessing.
Yeah.
I just see we don't know how well he's sleeping at night because that's the only time he's alone. So you know, they said at the dispensary, we'll add some CBD at night, so I'm getting 2 products, and it's just,
you know, I think part of what might be going on, it might even not even be related to this.
okay.
That if he's actually still staying up at night despite what you're doing,
Yeah, I'm not sure.
he's going to be sleepy during the day.
That's what
So
my
you
husband
kind of have to get that information straight first
Right.
before you make any, because it sounds like what you're doing is working,
Yeah,
but unless you know what he's actually doing at night,
yeah.
you
and
might change a lot of your regimen, and it wasn't even the regimen that was the problem.
Right, well, the only thing they said the last time I went to the dispensary, they said, because we're only doing 2 drops of the butterfly effects, 5 times a day. 2 drops, you know, and then
5 times a day.
2 drops 5 times a day, spreading
Okay.
it out.
Okay, and when you say you're talking about literal drops, you're not
1,
talking about
2.
droppers.
No,
Okay.
1, 2 drops.
Okay.
Told it, Daddy, you know, and they said, well, he's so sweet, and they said maybe add some CBD throughout the day. Well, like,
But to be honest, I would, okay, so I prefer if you could get that information about the sleep.
yeah.
But if you're doing, even though these are just small drops at a time, back off to 3 and see
3
if,
times a day.
yeah, let's see if, I mean, he might be sleepy because this is building up for him.
Okay.
And that might be making him a little bit more sleepy. And then he's sleepy during the day, he might still be up at night. But if
Yeah.
you're doing, even though it's a small amount, see what happens if you back off. Does he have increased pain? Is he more awake? Could you then replace maybe some of those THC drops with, I don't know what type of CBD, you know, we can look at what you're
Yeah.
using. See if that might help. It might still help with the pain, but make him less sleepy. Like,
Yeah, it's difficult because of the dementia. I can't get great feedback.
right,
And I have caregivers in the house.
right. And it's
so
sometimes hard to get the right feedback.
it's
Right.
hard to get the right. If I lived there, and it would be so much easier. But he does have severe spinal stenosis.
Sure.
And so I'm afraid to back off too much because I don't want his pain
Sure.
getting.
Even if you, instead of 2 drops, 1 drop, if you want to start there, or just back off of one of those doses and replace it with a CBD. But I think you first need to know, is he sleeping at night?
Yeah.
Because you
there's
might have
no-
a great regimen, and it's just that he just is still awake, and you could actually alter some of that to keep him awake.
Right.
But is he just getting sleepy after those drops during the day?
Yeah, and there's no way besides me getting a camera, and then I won't sleep because I'll be watching the camera all night, and everybody in my family knows that
Yeah.
because I'm the baby and I take care of them the best.
Yeah.
So,
The other thing that I would say is, particularly since you have caregivers, and I just recommend this to anyone that's trying to figure out their regimen, have a medical cannabis journal, okay?
yeah.
And so it's that way you're writing down what you're giving, also looking at how he's responding, and then when you make an adjustment, you can probably put in there something that, so are you the only one that's,
No. See, I have 4, I live an hour away from him.
okay.
So I have 4 siblings that help, and then I have visiting angels that help during the day.
So if you wrote out, this is the change for this week,
Yeah, they don't
then
follow
they could
it.
probably follow and hopefully make observations as well.
Yeah,
But that way, if you're following, if you have a journal, so you can actually document what the change is, and do that change for a couple of days at least,
right.
then you can at least know that. But no one stays with him at night.
That's the only time he's alone
Yeah.
is from 10 at night until 9 in the
Right.
morning.
So if you're not gonna start with that, then make a minor adjustment and see.
Because I'm trying to, this has been my goal the whole time, is keep his pain under control, but not make him sleepy. And
So when older people, their metabolism is slower, so that THC can actually last. Typically we're talking about drops underneath the tongue that might last about 2 to 4 hours for most people. However, for an older person, that drop, because their metabolism is a lot slower, that can actually last a little bit longer.
Okay.
So when I say pull back, I don't necessarily know if he's going to be in increased pain or what have you. You might be able to make adjustment and he won't be as sleepy.
Okay, so do you think it'd be worth it even for me to go to 4 times a day instead of 5?
Yeah, why not?
Okay.
Yeah, and
And
like
then-
you make the change, but you make sure you're watching what you're doing, and then seeing what the result is. You know, the thing is that if it's not working, you can go back to 5.
Right.
Yeah.
I get nervous about changing things because I'm not there, and then I already have opposition from my family about what I'm doing.
Mm-hmm.
So when I start changing things up, whoa, you know what I mean?
But if they're not supportive, then backing off one dose probably.
No, they'll be happy about that.
Yeah, that's what I'm saying. They'll probably be pleased as punch.
But if I ever add it back, then well, why? You know.
Yeah, one thing at a time.
Exactly.
Yeah, absolutely.
Thank
Bring
you.
them to the doctor.
I know, exactly. I know.
Yeah, tell them to call me.
I know. Tell me about it.
Yeah.
I have a question. Do you think in her case that her father could have just, because his metabolism is slower, because I take CBD products too, and some with THC, but it takes a long time sometimes for it to work
Kick
for
in.
me, like to kick in, and so then.
So are you talking about sublingual or?
Mhm.
Okay.
Yep, and so if I do the tincture or the edible,
Mm-hmm.
and maybe I ate, like I took it later, but I ate later, or
Mhm.
something like that, it may have a longer onset, and
Right.
then, so it takes me longer to get to sleep, and then in the morning, I don't have enough hours to kind of sleep it off. You know what I'm
So
saying?
now you're dragging.
So I'm a little bit
So that's what
dragging
I'm saying
early.
when it comes
Yeah.
to metabolism, it's
Mhm.
not just how many hours, but how long
Yeah.
it takes to kick in, how long it lasts. I mean, if you're doing this every couple of hours, if you're doing it 5 times a day.
After each meal, and then at 8, and then when at bed.
Yeah, you can
So-
back off and see how it works.
Okay.
Yeah.
I'll cut that 8 o'clock one for now.
Yeah, and then just see what difference that makes. I know you're afraid if you pull back too much, it might cause a lot of friction. So take it slow, do what you feel comfortable, but make sure you're watching what you're doing.
And still keep the CBD at night the same.
Because you think that
They just said maybe add more CBD at night to help him sleep. I'm just like I've been on my own here.
Can we see the product?
Absolutely. And I'm trying to keep his inflammation down, and
Yeah.
it's just been a guessing game for me. There's information on the side and on the bottle too. It might be bigger.
Oh, this is the butter. Is this the
Yeah,
butterfly?
that's
Yes.
right.
Do you have the CBD as well?
And the CBD is just hemp flux from mustard seed.
I'm sorry.
It's just the mustard seeds brand hemp flux.
Oh, okay. Do you know if it's full or isolate?
It's I think it's full.
This is just me.
Do you know how many milligrams are in the vial you have?
Oh my
I think it's
gosh.
750 for the whole bottle. Is
I
that
tried to
right?
give you the big
That
one.
would be decent.
I
I
tried
had
to
a
give
friend
you
that
the-
had a bottle and it only
Why
had
is it
30
so
milligrams in it.
Yeah.
I was like, this is literally not going to do anything
Yeah,
for you.
exactly.
Yeah, you don't need to.
Um,
It's small, but
Can you read it?
Yeah.
You know
got
what I
pretty good
usually
eyes.
do? I take a picture of it and then I blow it up on my
Right,
phone
yeah.
because I
Yeah.
can't.
Plus, with those labels, I get the same thing.
Is that
What
right?
info,
all the
what
range
info do you
of
want? 109 milligrams of
And then the cap
THC,
won't come
109
off.
mil.
it's off.
Okay.
120 milligrams of CBD.
Okay, so it really is about 1-to-1.
Is it a 1-to-1? Because that's what the doctor recommended.
Yeah,
is a
yeah,
1-to-1.
yeah, yeah. Okay.
You might need
So is that's a pretty good.
No, I mean,
Well, this might be why he's maybe getting sleepy during the day because it's a
Yeah.
1-to-1 then because
Yes,
you're giving him
yes.
CBD
I
throughout the
use
whole
that to
day.
sleep at night.
Oh, okay.
yeah, that's you're getting a good amount of
I don't-
CBD all day.
Oh, okay.
I don't know if they have
I mean, it's
other
only like a
tinctures.
drop, but
Oh yeah, but that's super concentrated, that stuff
Yeah.
too.
But he's not, holding. I don't know. Does it matters? He's not usually holding it like a minute. I mean, I do the best I can with him, but
It eventually gets
By the
metabolized, it's.
he's 97.
yeah.
Yeah. Do they? I don't know if they have other
I-
tinctures,
They
but
do, but you might need a lower.
yeah.
Those are the two.
So this is a 1-to-1 basically, right?
Yeah. Oh, I'm
Yeah,
sorry.
like if you, yeah, so if you could decrease, I just hate for you to buy one more thing.
Yeah.
And the
'cause
thing
I
is that
buy
you're only
this.
giving a drop of this,
How long does that
Yeah.
last you? That one bottle, roughly.
a lifetime.
That bottle 2 drops 5 times a day.
So
I'm going through that about, I don't know, maybe once a month I have to go to the dispensary.
I still think it's building up,
Okay.
and so I think
Yeah.
before I would change the product, I would skip a dose.
Okay, I'll skip the 8 o'clock dose for now.
So the only thing with skipping that 8 o'clock dose,
Oh,
and then
okay.
you're still giving the like, you're not, who's seeing how well he's staying, like, you've already built it up all day.
Right.
Like, I wouldn't say skip his morning, but would you do morning then lunch or morning?
He gets it breakfast because they recommended that he have it with food to counteract any tea.
Sure.
So he gets it after breakfast, he gets it after lunch, he gets it after dinner, and then
What if you skipped lunch and see what
Okay.
he's like at dinner? Because right now you're skipping, like, he's already had it build up all day.
Okay. And then we were doing just 2 drops at 8, because they said spread it out to 5. So I'm just, you know, like I said, I'm not a doctor, I'm just going by what they're saying, you know?
No, it just seems like it's building up.
Okay.
He's holding on to it longer than you're probably anticipating. So do you know when he's in pain?
He doesn't complain, but with the spinal stenosis, I notice him being more stiff, it's harder for, you know,
Yeah. Yeah.
I have to gauge it on how well he's walking.
Yeah.
And there's sometimes he's clear as a bell, and it's like I have dad back,
Right.
and then other times it's,
Yeah.
but it's helped.
Yeah. No, absolutely. I would think also having parameters of how you're gauging if he's in pain or how well he's doing.
Right.
So when you're talking to the home health aides, you know, determine how well is he walking, you know, how lucid is he, so that if you're just saying see how he does,
Right.
and particularly since he there's so much variation from one day to another, you have to use something that's pretty solid. Like how well he walks is a pretty solid measure whether he's in pain or how well he's doing.
Yeah, that is the measure for spinal stenosis.
Yeah, but whether how lucid he may or may not be might not always be very easy.
So for now, I shouldn't be.
Or if he's just sleeping. If he's sleeping during the
He's
day.
pretty sleepy during
Yeah.
the day.
So, but keep in mind, it might take a little bit for it to start wearing off a little. So don't expect one day and all of a sudden he's,
Right.
you know, give it a couple days.
And I shouldn't play around with that CBD vial at night. Keep that the same, because only change one thing at a time.
I would recommend.
Okay.
Yeah. And then that way you know what you're dealing with. I don't know if he needs this, like, are you giving him this at night? Does the 5 times a day end up being at night?
Yeah, it's after each meal at 8 p.m. and then bedtime. Just because I was trying to
Yeah.
divide it out five times a day. 'Cause
Take
I
out the CBD for right now. He's getting enough CBD.
take out the CBD and the lunch.
Yeah.
Okay.
Yeah. And then really see how is he doing. Yeah.
All right.
Yeah. Because honestly, he's getting CBD all the time.
Okay.
Yeah. Yeah. Because otherwise you're going to be
My
tiptoeing through
family
this.
will be thrilled with this
Yeah.
because they think I'm crazy.
No.
And I'm
see how
like, what are
he's
you
doing.
talking about? I got him off.
Yeah, he's more lucid, he's
His
there,
liver
more
is better.
vivid.
He's
The thing is that
moving.
if you're using a full spectrum, that's going to make you more sleepy, but you're already using this and it's already making him sleepy,
Yeah,
and his
at the wrong
metabolism
time.
is slower.
You know what I mean? At the wrong time.
Yeah.
It's making him sleepy during the day.
Yeah.
And without a camera, I don't know. And like I said, my husband said, you're not getting a camera because you won't sleep.
Yeah.
So I don't have a camera.
You can watch it during the day.
Yeah.
Why don't you spend the night with them once you change it, just so you can see and feel
Yeah,
like
that's true.
every now and then just
He
spend the
always
night
asks
with
me to
them.
stay the night.
You should. You should have a party. You
Yeah.
should. You know, seriously. And then just be able to like gauge them, and then you can see for yourself. You know.
But I have to, I mean, I know that he's better. Like yesterday, he had to have 2 teeth pulled, okay? I took him all day long. Daddy, in any pain? No, I'm not in any pain. Okay, great, you know?
That's good.
So I'm happy about it.
Yeah,
I wish I
Probably
could
was
gauge.
super high. I love him already.
I wish I could gauge it better.
Yeah.
I wish I could, you know. And I've been tweaking with this since I started on with him almost a year now. But you know, I go by what they tell me at the dispensary, and I play around with it on him. And with me not being there 24/7, it's been
Yeah.
kind of a.
The only reason I'm suggesting about the CBD is a totally different time of day for totally different reasons, and you already have, I think, you're getting enough.
Okay, he's getting in. Okay.
Yeah.
I think if you can get a CBD-free tincture for the daytime and then have the CBD at nighttime, it'd probably be a better combination in the long run. If that CBD's
free. So the reason they did this is because they're afraid of him having any sort of high effect.
Yeah.
So they want to like make it completely without. I would say just with your family and what you're telling me,
Yeah, I'm behind the
If
8 ball
he's-
at all times on this.
Yeah.
I'm the
But I
crazy.
hear what you're saying, but
Yeah.
they're trying to knock out any sort
Helps
of
counteract
euphoric.
it, yeah.
Right, yeah. So,
So it still would be okay if I don't do that CBD vial at night.
I mean, you have to do what you're comfortable, but what
No,
I'm
I
saying,
mean, you think
like,
you
they
get
kinda
enough
did that,
CBD
yeah.
throughout the day? Okay.
Yeah. Yeah, and then depending, like, you'll know, oh wait, he still needs this dose during the day, or wait, the sleep's off, so he needs this during. Like, you'll know which one you have to alter. If it was around the same time, it might be different, but these are 2 totally different times a day, and CBD can make people feel a little bit more sleepy.
Right.
Even like like I said, it's all building up. You just need
Okay.
to kind of pull back
Okay.
and then reintroduce.
Okay.
Yeah. Like, I remember at one time I was taking CBD. I'm thinking I'm fine. I was so incredibly sleepy during the day, and I didn't even recognize it at first.
Right.
Pull back, and then start with a cleaner, neater regimen, and then bring it back in as needed.
Okay, so pull back the lunch and the vial of CBD at night, and then.
Yeah.
Okay.
Yeah. I don't think it'll be confusing.
Yeah, I get nervous about increasing his pain. I mean, because there was a point on the meds that he could barely get out of a chair.
Mm-hmm.
You know, and I just get scared about that. I'm like,
Mhm.
well, I'd rather have him sleepy than not be able to move. You know, and it's all this stuff that plays in my head.
Yes, I heard.
Absolutely. Very good. Yeah.
Can we have samples of your stuff?
Yeah.
Please?
I don't know what I do there. Okay, so so what do we have here? So this is the isolate, okay? So no THC whatsoever. It has the same terpene profile of gelato, which is a popular cannabis strain. So the terpenes are the essential oils of CBD or of cannabis. And so with gelato, the terpene profile kind of reflects terpenes that are helpful with anxiety as well as pain. So if you want, to try some, so this one, so it's a little bit more grassy because it's kind of heavier in the terpenes.
I like it.
Did you try it?
Yeah, when you first,
Oh, that's right. Yeah. I forgot a long time
yeah,
ago.
that bottle went fast.
It is important, correct, that he holds this under his tongue and best.
Yeah, so the longer he holds it, the more he absorbs it. So let's say he doesn't do it great, that's still
Right.
fine.
Okay.
You know, it's just how much he's able to absorb it directly into his bloodstream versus more going through his GI system.
Right.
So he's getting some of the, how do I get out of here? He's getting some in his GI system regardless, because of just, you know, he's not letting it sit there forever.
Right.
You know what?
Did you want to try it? Okay, so I'll tell you, this is my favorite.